development on that front where Assam can be is being developed into a medical education hub or a medical hub?
So yes, we have thought of it that this is the gateway, and all the northeastern states are heavily dependent upon Assam. Quite a wide array of, I would say, topics that we have touched upon: quality, affordability, healthcare, is the universal health coverage. So one, by establishing these health institutions. B is by providing insurance coverage. But it would be one of the top 5 states in the next 5 to 10 years window. It is going to be one of the top 5 states in the country in terms of infrastructure, in terms of HR, in terms of... So I would say it is better than most of the states. Typically, Assam spends approximately 8% of its budget in health. So I would say in the next 4 to 5 years, Assam would be one of the best performing.
Namaskar, hello and welcome to this special episode of IndiGlobal Edge Factor. IndiGlobal Edge Factor brings to you latest developments, trends, technologies, innovation and best practices in the field of healthcare and well-being. IndiGlobal Edge Factor is presented by IndiGlobal Media Network that takes innovation, collaboration and growth to the forefront. And today we are connecting with you from the beautiful landscape of northeastern India, Guwahati, Assam. And we are joined by a special guest who is a 2005 batch IAS officer, Assam and Meghalaya cadre. He is known for several transformative initiatives in his position that he has held in Swachh Bharat Mission and several other positions. We'll get to know more in our personal interaction in this special episode of IndiGlobal Edge Factor. Currently, he is holding the position as Secretary and Commissioner for Medical Education and Research with the Government of Assam. Please join me in welcoming Dr. Siddharth Singh, Commissioner and Secretary, Medical Education and Research, Government of Assam. Welcome, sir. Thanks for joining us.
Thank you.
So before we proceed with our this special episode of IndiGlobal Edge Factor, we would like to know where were you born and brought up and your educational background?
So I was born in and brought up in Uttar Pradesh, and most of my schooling was done in Allahabad, and even my college I studied in Allahabad University, and after that I qualified for this exam. While in the service I completed my PhD and got a doctorate in anthropology. So it has been 17 years that I am in Assam presently.
Amazing, sir. Currently you are dealing with the medical and healthcare and medical education. Can you take us through the kind of initiatives and on-ground work that is happening in providing quality and affordable healthcare to the citizens of Assam?
Okay, so this is quite a wide array of, I would say, topics that we have touched upon: quality, affordability, healthcare. So now, just to give you a snapshot of what we are doing. So since independence till about 2010, Assam only had 3 medical colleges for the 30 odd districts. But by that time, the government realized that the number of doctors required as per WHO norms or IPHS norms would never be sufficient if we have these number of medical colleges. So there was a felt need of increasing the number of medical colleges. And the present Chief Minister of Assam, who was the Health Minister at that point of time, he conceived that this is very essential that we increase the number of medical colleges in Assam. As a result, in the next 10 years, from 2010 to 2020-21, we had another 5 colleges coming up. So 8 colleges, and this 2022 we added another college. So now we have 9 medical colleges in Assam, the newest entrant being the Dhubri Medical Colleges. But the good thing is that we are making 15 more. So we will be having 24 medical colleges in Assam by the next 5 to 6 years. and presently we have applied for the letter of permission from the National Medical Commission for 3 medical colleges, that is Nalbari, Nagaon and Pokrajhar, and we expect that we will be able to commence courses in all of them in the coming session, that is around September. So infrastructurally, if you see, medical colleges is one. Secondly, we are also aware that medical colleges, apart from doctors, is also supported by paramedics and nurses. So we are in the process of establishing nursing colleges in each of the medical colleges, so that we have quality supply of nurses. We are also in the process of setting up a paramedical college. Apart from that, the Department of Health and Family Welfare has been split into medical education and research to mainly focus on the medical education and research part. So a lot of work in terms of the infrastructure is being done. Now, as far as the affordability is concerned, we generally follow CGHS rates, and for a lot of categories of patients it is free. Now, one of the major issues in healthcare is the universal health coverage. So one, by establishing these health institutions. B is by providing insurance coverage. So now insurance coverage, as far as insurance, so now we have a scheme called the PMJY, which is the Government of India scheme, Pradhan Mantri Jan Arogya Yojana, under which families are provided medical insurance coverage of 5 lakh. We have a state scheme which is called Atal Amrit Abhiyan, under which individuals are provided medical coverage of 2 lakh. Now we are in the process of converging these schemes, and the database which would be used would be the NFSA, National Food Security Act database. So we'll have around 2.52 crore beneficiaries covered under these 2 converged schemes by April. So it is going to be a huge task. Already we have 337 empaneled hospitals, and the reach would is going to improve. So as far as quality is concerned, we are going with a lot of measures, including strengthening the Shankar Dev University of Health Sciences, that is our index university, in taking a lot of talent from private sector, improving upon our management capacities, and a lot of other initiatives.
What are the kind of collaborations that are happening with the private players, and also the Assam is considered or is also being projected as a gateway for the Association of Southeast Asian Nations. Is there any development on that front where Assam can be or is being developed into a medical education hub or a medical hub?
So yes, we have thought of it, that this is the gateway, and all the northeastern states are heavily dependent upon Assam for availing medical facilities. They are also coming up, medical facilities in those states are also coming up, but still it will take some time. Till that time, Assam has to bear that responsibility too. We are also catering to a lot of international patients. So medical tourism is something which is a very big upcoming field. So with the establishment of these medical colleges, apart from that, one of the parts that you asked was collaboration with private sector. Now, one of the shining examples of collaboration with the private sector is our company called the Assam Cancer Care Foundation, under which we are establishing entire network of 17 hospitals, 7 of which are already functional. We have partnered with the Tata Trust and started a company called the Assam Cancer Care Foundation, where on the board chair is being held by the Honorable Chief Minister. We have equal representation from the Tata Trust, and the company, day-to-day affairs of the company is being run by a professional setup which is outsourced from the market. So under this, the idea is no one has to travel for more than 2 hours to get good cancer care. So now we have state-of-art machinery in these cancer care hospitals, including LINAC, PET scan, PET MRI. We are also going in for robotic surgery. A lot of new things are happening. So a lot of patients from entire Northeast as well as Bangladesh and neighboring countries are coming here. We are also in the process of establishing a company with, in fact we have established, the project is ongoing with IIT Guwahati. Now that would be a research center as well as a medical school. And we are going to attract talent from across the country and abroad. It is going to be a center of excellence. And it would be doing a lot of research in the sunshine sector, like wearables, stem cell research, DNA transcription. A lot of these fields would be taken up under that project. So a lot of exciting works are being done in Assam under these sectors, and it would be benefiting not only Assam but also the neighboring states as well as the neighboring countries, and we expect a lot of inflow of patients from the neighboring countries also.
Amazing, sir. Technology plays a very important role, information technology and its other emerging technologies. How is the state of Assam embracing technology and is integrating the various modern technology in delivering the healthcare services to the citizens?
So presently under the Ayushman Bharat Digital Mission, Assam is one of the best performing states in the country. So more than 50 lakh Abha IDs have been generated in all the government hospitals. The overall overarching aim under the ABDM is to bring all the medical records on a digital platform. Sam is moving very fast on that. All our medical colleges and the facilities down below, we are aiming to get onto the hospital management system. Also, we are just in the process of starting a hospital human resource management system, HRMS. And finally, our insurance schemes are fully on a digital mode. So every claim is digitally processed and payments are released digitally. So apart from that, as I said, robotics and a lot of these fields are being also dealt in the project with IIT in the sunshine sector, the new technologies, emerging technologies. We are also partnering with some startup companies to introduce certain new technological issues which will enhance our outreach of the medical care without actually requiring physical infrastructure. One is telemedicine, teleradiology, also the hub and spoke model of EICU. So all those are being done in Assam.
Any kind of disease profiling that has happened and kind of research on that front?
So that is an area we have just started. So the ACCF program was the reason was a result of this kind of profiling, because Assam and Northeast gets disproportionately high number of cancer cases compared to the rest of India. Vis-a-vis the population that is there, the number of cases which are there are very high. So disease profiling then resulted into this kind of a structure. Similarly, the congenital diseases, we realized very early that this is very high. So as a result, we tied up with some private players as well as, and now we are going to have some 10,000 operations which will be formally launched, 10,000 patients cured under that program. So yes, profiling is being done, but next year we are going to do it on a very intensive basis so that our investments flow in those diseases, apart from the IMR and MMR issues which we have already identified.
Yeah, it's an amazing progress that is happening in the medical field. Majority of the population in Assam, more than 80%, are in the rural areas.
Right.
Any special attention or initiatives taken those lines?
Yes. So as I said, to cover the rural areas, NHM is doing a lot of work. So you must have heard of the boat clinic, the MMUs, a lot of outreach programs. Apart from that, 4,000 health and wellness clinics are being established. The idea there is it would be doing a lot of, as you said, the disease profiling, the simple diseases, and in case it is required, they can be referred to higher centers. So cancer profiling can be done there. A lot of profiling is being done, and these centers are being in the process of being set up, and the medical equipment as well as the HR is being assigned. So once we have that on field, we are going to have a huge reduction in the disease burden of the state by proper diagnosis at the right time. So rural level, apart from that, as I said, all our digital initiatives like teleradiology, telemedicine and all is helping our outreach in the rural areas also, apart from setting up a physical brick and mortar kind of clinics.
Yeah, great, sir. In terms of the kind of work that has taken up on ground, now how do we look at Assam in the coming years? How is it going to emerge as?
So I would say in the next 4 to 5 years, Assam would be one of the best performing. It still is, but it would be one of the top 5 states in the next 5 to 10 years window. It is going to be one of the top 5 states in the country in terms of infrastructure, in terms of HR, in terms of the services available in terms of the various health indicators, we are reaching there very fast. Our efforts are very, very intensive in nature, and for every kind of problem, we have thought of a solution which is both short term and also long term arm is there, so that we take care of the long term objectives that we have set out to do.
Wonderful. Government of India has a special emphasis on the alternative medicines also. Ayush is a special ministry that has come up. What is the progress on that line?
So, under the Ayush, we are developing the Guwahati Ayurvedic College, which is a very old college, into a center of excellence. Apart from that, another college is coming up at Dudhnoi. So, we are putting a lot of effort on the alternative medicine. So, a lot of issues related to their HR, which were pending for quite some time, have been resolved in the last 1 year. So, in going ahead in the next 3 to 5 years, we'll see a lot of improvement in this Ayurveda homeopathy, or the Ayush sector as we call it.
What is the size of budget that is being allocated in the healthcare, health education and research?
So, I would say it is better than most of the states. Typically, Assam spends approximately 8% of its budget in health. And under medical education and research, last year our size of budget was around 2200 crore. This year we expect it to be far more. But if you take health and family welfare also, the budget size would be something like 8 to 10,000 crore.
Wonderful. Sir, any message that you would like to give to those who look up to the northeastern states and Assam as an investment, as a place where they can take up education in medical, and maybe looking up to Assam as a place for good treatment, quality treatment?
So I would suggest that for all those who have any apprehensions about Assam, it is one of the safest and best places in terms of medical treatment and all. I would say we have already improved significantly. In probably 2 to 3 years down the line, we'll be at par with most of the southern and western centers of the country. And it is a great place to come and have treatment for, because though we are a small state, the medical facilities are at par with the rest of the countries. And 4 to 5 years, 3 to 4 years down the line, we are going to have medical facilities which would be better than most of the parts of India.
Amazing, sir. Thank you so much for joining us.
Thank you.
So that was Dr. Siddharth Singh, who is the 2005 batch IAS officer, serving as Commissioner and Secretary with the Government of Assam, looking after medical education and research. Till the time we join with you with yet another special guest, this is Sudheer Goutham signing off with a special initiative of IndiGlobal Media Network, that is IndiGlobal H Factor. Thank you.